Hello, how are you? This is Dr. Sailaja Reddy. Today I'm going to explain you about functional medicine. What is functional medicine and how is it different from the conventional medicine? So our society is experiencing a sharp increase in the number of people who suffer from complex chronic diseases such as diabetes, heart disease, cancer, mental illness, and a lot of autoimmune conditions. The system of medicine that we practice nowadays is by most physicians is oriented towards acute care. It's not well designed for the chronic care. If you have appendicitis, if you had some trauma, this is perfect. You get the treatment. Lacks the proper methodology and tools for preventive and treating complex and chronic diseases. So when we need, what we need in the treatment of chronic diseases is we have to consider at your unique genetic makeup, and we have to look at your toxin, the toxin exposure, and we have to look at your nutrient status. All these things are not there in the current system. Most physicians are not adequately trained to assess the underlying causes of complex chronic diseases and to apply strategies such as nutrition, diet, and exercises to both treat and prevent these illnesses in their patients. So functional medicine addresses the underlying root causes of the disease using a systems-oriented approach. It is an evolution in the practice of medicine that better addresses the healthcare needs of the 21st century. We all know that by shifting the traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person, overall health, not just the isolated set of symptoms. So this is functional medicine tree. This is what the current conventional system uses. Endocrinology, gastroenterology, cardiology, pulmonary. This is basically organ-based medicine. Now we need to shift this thinking to physiological systems. So functional medicine model maps signs and symptoms and diagnosis into the areas of imbalance that are organized into 7-sided matrix. This is basically the functional medicine matrix. We are looking at the assimilation, which is basically the digestion, absorption, and the structural integrity, musculoskeletal system. This is the communication, endocrine and neuroendocrine function. And this is transportation, which is basically cardiovascular system and lymphatic system. Here, this is biotransformation. You look at the toxins and detoxification. And energy, here we look at the mitochondrial function, see how your energy system is working. And this is the most important, defense and repair. In this current pandemic situation, we are focusing a lot on immune system. So we look at the body from a systems perspective. All systems are interconnected. For example, if there is a problem with the hormone balance, we know that it will affect the immune system or the gastrointestinal system. When we have conditions, for example, depression, it could come from many causes. Depression is not a Prozac deficiency, right? There are many root causes. Like it could be from the gastrointestinal problems, it could be from the nutrition deficiency, it could be from the toxins, or it could be hormonal. So we don't just give the medication for that. I mean, initially, the initial stages we give it, but eventually we have to look at the root causes and not just give the medication to the patient for the rest of their lives. The same thing applies to everything, autoimmune conditions, or when it comes to the regression of the diabetes or cardiovascular conditions. We look at all these causes. So the mindset has to be shifted from pill for an ill to find and work with the root cause. So health is your right. It's not a privilege. So thrive instead of just survive. That's my message. Hope you understood what functional medicine is. If you have any questions or if you would like to get the evaluation, please check the link roothealthmd.com, roothealthmd.com. So we'll be glad to help you out. Thank you so much.